I chose to go into pediatrics, and particularly pediatric anesthesia and intensive care, because I found the children and patients are very resilient. They're just, I like their spunk, and I guess it matches with my personality. I don't know, perhaps that's it. A doctor who's an intensivist is somebody who's taking care of children or patients that come into an ICU and they're critically ill. And our role is to provide the state-of-the-art medicine and taking care for their critical illnesses, but also to try to coordinate all the different consultants who've come through and the different surgeons who've operated on the patients and the different cardiologists that are referring the patients. So it's kind of a person that's coordinating all of that, focusing in on the critical illness that's affecting the children. It's been a very challenging, very intellectually stimulating, very rewarding career. And I love the science in it and the technology in it. We do everything in our power to take care of their children. You know, it's just that simple. We don't let anything interfere with that. If that means speaking with the FDA in the middle of the night to get an emergency drug from compassionate release, or us go bring in an expert that might help us take care of the baby in a way in which we feel is best, we'll do it. And I think that's why families should come here, because they're not just a number here. We know they're children, and yet the quality of care that we provide is well ranked among the national best. We're providing the state-of-the-art medicine in the most compassionate, empathetic way that's humanly possible. But at the end of the day, I would say I'm still a mother, and I still think about what would I want if my son was lying in that bed, and I would want to be sure that somebody's doing his homework with him. That one individual is a very smart young man who needs to know about Huckleberry Finn, so we read that, and it's as much of a way for me to unwind a little bit at the end of a busy day or at 1 in the morning, and as I hope it is for the children.
Can't believe you're really retiring.
I just can't get over it. I just can't. I know we're going to have a hard time.
Dr. Deb Davis is a pioneer and trailblazer for women in medicine over the past 42 years.
We will miss you.
You are truly unforgettable, and you leave an imprint on all our hearts from your big heart.
As a recognized worldwide leader, she has forever impacted patients and their families.
You're simply the best. Better than all the rest. Better than anyone. Anyone I ever met.
Deb's accomplishments are too many to list, but our best memories of her are around the human side of working together.
A wonderful life.
Things I love most about Deb are her intellect, her dedication to the ICU, her willingness to call out BS.
No one deserves it more, and you've always remained true to yourself. One of the best anesthesiologists in the world.
I'm very thankful for the support and always having my back and kind of helping me through the last 4 years. I really appreciate it.
If I have 3 things to say about you, I would say you're first and foremost a nurturer, a teacher.
I've definitely learned a lot, definitely laughed a lot.
And certainly a breath of fresh air.
And I've definitely been fed a lot, so thank you for always keeping me nice and full.
Deb has been so much more than being a boss. She's been a trusted mentor and a dear friend. She's taught me so many lessons, and as I advance in my career, those lessons become more and more important.
We miss everything about you. Your expertise, your laughter, your humor.
And I hope Dave will still remember me and send me a flatbread every now and again.
Oh, your all-around wonderfulness, your prayer.
There's no one else I'd rather, work with in the CICU than you, because you tell like it is, and I think it's all something that we need to hear every now and then, and we will miss you.
You've taught me so much, obviously, about medicine from the time I started when I was a little 24-year-old person, and until now, is equally as important, a lot about life as well.
She saw my potential and she saw my passion. She made sure to foster it in any way that she could. She encouraged me because she believed in me as she believes in each one of us.
All the hard work and dedication that you put into your craft. There are many, many kids that have a better life because of that. Wonderful job done.
You certainly make all of us and patients feel very welcome.
She was senior author on my first abstract and my first presentation at an international conference.
You give amazing professional guidance and advice.
Her fierce advocacy for her patients, her fierce advocacy for the nurse practitioners and physician assistants, and our many heart-to-heart talks.
So much expertise, so much teaching.
Your persistence, your pioneering in the field.
So much knowledge and so many laughs.
Yeah, that's the best part about it.
She didn't teach me how to play the game, she taught me how to change the game.
You have always been a steady, insightful leader and a blast to work with.
Thank you for the guidance, thank you for the mentorship, and thank you for the friendship. Most of all, thank you for the laughter.
One love, one heart. Let's get together and feel alright. Hear the children crying. One love. Hear the children crying. One heart. Saying, give thanks and praise to the Lord, and I will feel alright.
Congratulations, Deb.
Congratulations, and I know we'll see each other a lot, but best wishes.
Let them all pass.
Bye, Deb. I know we're going to see you. Love you.
You are going to be so deeply missed here. I love you, Deb. I wish you the best.
Thanks for everything over the years and everything you've done for the Cardiac Center here.
Congrats, Deb, on your retirement. I love you.
Love you.